In the United States, patients typically visit their primary care physician as their first step when issues arise in their lives that cause concern or discomfort that impair their participation. To develop the skills of different practitioners within the setting, the staff must first identify the full scope of practice for occupational therapy. Occupational therapy professionals are broadly trained in human development, health promotion, disease process intervention, activity analysis, behavior modification, lifestyle interventions, and the use of adaptive equipment, working as a team to assess the patient, identify relevant issues and symptoms, and develop and deliver the appropriate interventions on the spot. Will be going beyond the prescription of medication and a referral to the outside provider, which can typically be done through a primary care team. This team would be responsible for the whole person and the health of the whole person.
When training an occupational therapy primary care staff, the focus is to identify personal skills, strengths, preferences, and relationships within the community that are applicable to creating a primary care OT position. Building a foundational relationship with the primary care physicians is especially important to build a more cohesive primary care team. OTs will spend time shadowing PCPs, which provides an opportunity to observe the PCP's needs and assess their knowledge of the role of OT and their interest in integrating OT into their practice. This is important because OTs will need to use their full skill set when working with the broad population within primary care.
As far as the resources that are needed in a primary care setting, we must consider that the primary care setting is constantly evolving and changing simultaneous with society. Therefore, the medical staff will have a responsibility to continuously develop and refine their skills. Educational institutes can provide the opportunity for lifelong learning by including the programs of continuing medical educations. Our staff would greatly benefit from our partnerships with organizations such as these that offer clinical education courses. Each discipline will have their own continuing course, as well as other opportunities for certifications and other advancements. Other accessible organizations would include American Heart Association for mandatory CPR renewals, AED use, management of respiratory arrest, arrhythmias, acute coronary syndromes, stroke, and other additional healthcare provider courses. Additionally, in order to give back to our community, the clinic would partner up with medical educational institutions to allow student fieldwork opportunities, creating a learning environment. Contracts would be created as needed, and other educational links and organizational links would be filed in a cabinet within the primary office.
Budget-friendly training and development options are really important for this primary care office's success. Training is a safe environment where the staff can feel comfortable trying out the new skills and perfecting old ones. Competencies will be held for each staff member every 3 months to ensure that they are being compliant with the current care services that are being offered. And to ensure that this is budget friendly, we're going to have these competencies run by a staff member. To ensure the ongoing development as a leader of this team and the success, it's going to be vital that we continue to develop and grow as an organization. Bi-weekly staff meetings that are open for the team to discuss their concerns and strengths will be one way to keep the staff motivated to work hard. According to Jesme, Towle, and Wiseman, staff education should include a formal orientation program, cross-functional training, maintenance of professional skills, coaching, career development, and personal development. The return on investment for this includes employee retention, which is also known as having the staff members develop a loyalty to the practice, staff morale, which includes a culture that encourages learning and fosters education to create a positive and more motivated workforce, practice efficiency, which includes orientation and cross-training, which are essential for running a smooth office, job competency, and patient satisfaction. Another ongoing way that we're going to boost staff morale and employee retention is to host celebratory events as a reward when the company goals are met. To ensure these parties are budget friendly, we're going to host no more than one party a month, and we're going to have a set budget for each party so that it's within our limits. So the ongoing development as a leader of this team, once again, it's really crucial to ensuring the success of this company. Thank you.